Hi, I'm Lindsay with IV Drip Launch, nurse practitioner, and I'm going to go through a patient scenario today with you and guide you in the process that goes into upselling the patient. I had a gentleman call in to schedule. He saw on the website that we had a brainstorm infusion. Our name on that is called Brainstorm, and in that infusion it has certain vitamins, peroxidine, taurine, and alpha-lipoic acid. He doesn't have an understanding of what's in this. All he knows is that he wants improved cognitive function, information processing, and learning memory. So he's aging and he has a young child that he wants to be young and vibrant for the years to come. And so he's looking ahead thinking, I'm starting to get old, I want to be sharp, I want my mind to be quick, and so what can I do? So he came in asking these questions to me, expecting that I was going to offer him a really great treatment plan. I always try to keep in mind that the patients aren't necessarily focused on what they're spending. They know this is going to be costly to them. They understand that this is like luxury medicine. And so try not to think about the guilt that's associated with charging your patient. They're coming to you wanting you to fix their problem. And so do that for them. Consider what they have going on in their health history and give them the best treatment that you can. So what went into this in the initial consult is that I discovered his health problems, of course. He had healthy kidneys, healthy liver. On that end, he was good to go, no heart issues. His biggest complaint was he felt like his brain was getting more fuzzy. He was having a hard time with his memory. But he also mentioned that he had some tingling in his hands. And maybe he was pre-diabetic, but he didn't have any diabetic medications that he was on yet. And so I knew that this is the good IV selection for him to give him the Brainstorm, because giving those vitamins that help support your cognition is going to be helpful. But ultimately, I felt like he needed the NAD because of his age, maybe the tingling in his hands. He possibly was looking at some neurodegenerative problems. And then also, what's the nerve transmission going on in his brain? Like, could he use some help with that? So I presented to him that, okay, let's do this Brainstorm IV, and this is, roughly $180, depending on what your cost is. So let's get him to come back for more. So let's give him the best IV solution. So with the $180, that's kind of your baseline price as far as what the IV is going to cost him. So he comes in knowing he's going to spend that much money. So with the NAD, that charge is going to be based on how much you're giving the patient, and you need to take into consideration what amount is going to benefit him. So in my mind, I thought, okay, a 250 milligram starting dose might be appropriate. He's never had this before. But I thought that 500 milligrams might be more appropriate for what he has going on. So I presented this to him, like, we can try 250 milligrams and see how you tolerate it, see if there's any benefit from it. But I really feel like you need 500 milligram dose. I think if we start there and come up with a schedule and then taper off, depending on how you feel, I think is the best place to go. So he agreed to go with my recommendation. So we gave him the 500 milligrams. And then I suggested that you come in weekly for up to 4 times with the same amount of NAD. We can change the vitamins, of course. You don't have to do the same one every time. So that's what we did. We changed the baseline IV recipe each time he came in, but we stuck with the same dose of the NAD because I know that this patient probably has really low NAD levels. So if we can get him up quickly and get him to feel really good, he's going to keep coming back. And he's also going to trust me because he knows that I'm not going to continue him on these high levels forever. So be open with the treatment plan with the patient so they know that, okay, this is what it's going to cost me up front, but I'm going to feel really good. And after that first infusion, now they know they feel really good. And so that's exactly what happened is he came back for the next week and he had just amazing results with his infusions. He was so excited, and at that point he trusted me that I knew what I was doing and that I could help him. So he scheduled his next 3 infusions, and so we did that same dose. And then I told him at that point, okay, now call me when you're starting to feel like you need another infusion. It might be in a month, it might be 3 months. And so I heard from him probably 1 to 2 months later. He came in for another infusion. And at that point, we were able to lower our NAD dose and still get the same results, knowing that he's probably got residual NAD levels, boosted levels in him from the previous infusions. And he's done really well on that, and now he's coming in probably about every 3 months. We are doing a 250 milligram dose. At this point, he has tried 500 versus 250 just to see if there's a difference. He doesn't notice any change between those doses, so he does stick with the lower dose now. So this is a great example of how this patient came in planning to just get a baseline IV. And I just felt like this is the perfect scenario. I know NAD is going to help him and he's going to feel really good. And so the end result was I was able to make some more money on this patient, and he had really awesome results, and he was happy to pay the fee. So don't be afraid to think about these things when you're talking with your patient. The other thing I did with him as well is glutathione push at the end. Glutathione is almost always a good idea to add that on. It has a lot of great properties, and the chelation effect that it has in your body. It's just a really great antioxidant. So that's always a good option, and it's a pretty cheap option to add on. So patients are usually almost all the time willing to do their glutathione push at the end. So just try to think about the ways where you can make this a better experience for your patient, and also from a business standpoint, making a little bit more revenue.